Hey everybody, sorry for the delay on videos. I know it's been about a week or so. I was working on a project where I'm trying to make my own workbook, going over practice EMS questions, but I think I'm spending a little bit too much time on it. It's a lot harder than I thought it'd be. I mean, I'm not trying to like underestimate the process of making like a workbook or a book, but I really didn't expect it to be this hard using like Adobe InDesign. I'll show you guys a little bit more of it later, but if you want to see a little bit of updates, you can always join the Discord, the link's below. But with that being said, we're going to go ahead and check out some frequently asked questions number 2. So, super excited for the AEMT course. I hope you do a good in-depth description of how you go about getting IVs. I've definitely lost all practice I've had during my class and ride time. So, that's a great question about making an IV video. I've been planning on making one. I actually did make one in the past, but I kind of scrapped it because I didn't like how everything went. But I do have some nice B footage or like background footage that I can utilize. I have a lot of tips whenever it comes to establishing IVs. I think I really just need to sit down and work pretty hard on it, but great question. If I have any great recommendations to start off, a lot of people, whenever they establish an IV, they get flash and they immediately try to advance. But if you look at the needle versus the actual catheter, you're going to see that there's like about maybe a fifth or a quarter of an inch. There's just the needle versus the actual catheter. And if you advance it just like a quarter inch or so, then you're going to establish that catheter all the way inside the vein. And then advancing is usually the part that people struggle with the most. So that's my early recommendation, but we can go more into it later on. Are you a firefighter as well, or a station medic at a fire hall crew? It's a great question. I work as a firefighter and as a paramedic. I've been doing it for about 4.5. I'm just about to hit my 5-year mark. They gave me an early 5-year pin, but I still have to wait till March to hit 5 years. What I do is I spend 24 hours on the engine and 24 hours on the box. However, if there's no medic for the shift, then I will be a medic both days. There's rare occasions where I'll be a firefighter both days, but more than not, I do enjoy the medic part just a little bit more. But I do like the physical part of being a firefighter. So sometimes I'll work as double medic. I used to have a station where I was the only medic on shift, and I kind of liked it, honestly, where I worked probably like 7, 8 months in a row, where every shift for 48 hours straight, I would just be the lead medic. I thought it was pretty fun, but I do like how I'm going more back into fire. I also have my fire instructor, my fire officer, my driver operator. So I do have a couple courses in it. I've helped teach some fire classes before, but not too many. Another question by Cool Breeze again. Oh, that last question, by the way, was from Nino Capanen. Okay. Another question from Cool Breeze here. Hey Mario, have you ever thought of opening a Discord for community engagement? There seems to be a lot of new EMTs and those interested. I'm sure there are some paramedics and other instructors in your community that da 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 da. I guess I never clicked read more whenever I saved this comment. Sorry about that. But we do have a Discord. You can look in the description and join it with us. It's actually pretty fun. I usually check it out every single day and I'll respond to some comments. We have some pretty fun discussions, so I'd highly recommend joining it if you're interested in EMS or just want to talk about medic, firefighting, just like in general. So it's a lot of fun. Here's a question from Bruh D4KU. I don't know what that means, but that's funny. Would love to hear some of your stories. You seem pretty funny. Could you put in some crappy animation like Salmonella or Casually Explained too? So whenever he asked this question, this must have been almost like a month ago. I started messing with like animation tools on Adobe, and I just don't get it. I need to work on it, but I definitely do have some funny stories in the past. I just recently, like, I can't say the actual date, where I had an elderly patient who was very confusing and they were talking nonstop. And it lasted about 30 minutes long. And I was like, what's going on? They're A no times four. I don't know what's happening. And I brought her to the hospital. It was a very weird call. And I'll go more into definite maybe whenever I do like one of these story videos. But it just ended up being that she was on drugs the whole time. And I should have caught it whenever she said that she doesn't sleep that much. But it's just an elderly patient, so you wouldn't. I always think the best of my patients, so I didn't expect them to be using drugs at the time. But great question. Here is American Human Interference Set 7550. She says, my husband works as an AEMT, and I like to learn about what he does. Even though there's a lot of jargon that goes right over my head, I'm trying to learn. That's super sweet of you. I love that you're interested in your husband's field. and we'll try to go more into depth on some questions. Maybe we can help you out. But if you have any other questions regarding like what it is to being an AEMT, if you are a transport company, you'll work as an AEMT and you can potentially be lead then. If you work as a firefighter and you have your AEMT, a lot of times you'll be the main one for the call for medical calls. But what an AEMT is an advanced EMT. They can work technically as an ALS truck. The next step is paramedic, and I always recommend for people to go for it. But it's a good profession. Another question, I don't know why I organized it this way. Is CPR performed any different on women than men? That is a fantastic question. So, just like any other individual, we're always going to worry about doing compressions. I'm not going to stop my CPR efforts for modesty for a patient, but there are some things that we're going to consider, right? So, we want to remove their shirt and cut it off so that way we can work CPR. But if we're working in an open area, we will usually have a captain or maybe PD that'll keep people away from looking at the patient. We want to maintain as much modesty as we can. And we'll bring the patient inside the box pretty early instead of working it on scene, where instead we'll just work on it in the box. We'll try to close off the area. If I have a deceased female patient, I'm really quick on covering up both of these individuals, either women or men, but more so for females. I just want to make sure that they, at the last moments, that they have some modesty. It's the same thing whenever we're establishing an EKG on a female. 99% of the time, if you're establishing a 12 lead, you shouldn't have to see the nipple. You should be able to work around the patient, getting the right arm, right leg, left leg, and then whenever you're doing V1, V2, and V3, V4, V5, V6 around the left breast, you can just ask the patient to kind of hold their shirt around their breast, and the shirt should hug around them as you're establishing the 12 lead. So I always try to perform more modesty if possible. If I'm working CPR on a call, for instance, if I have the chance, maybe I can cover up or at least look away to some extent while I'm doing CPR, but it's really the last thing on your mind. It's more so you're worried about bystanders visualizing you doing CPR on a woman that's uncovered because you want to, again, give them the modesty that they deserve. Same for men, by the way. I always try to cover up my patients, especially whenever I go into an ER. If they are in their underwear for either one, I will at the very least, get a stretcher sheet and cover them up. Just take that extra moment to, again, give them some decency. Ooh, this is a long one. So, from Smokey the Bear, love the video in your channel. I will be in EMT basic school later this month through a community college. I'm worried about feeling out of place at the community college where classes are held. I'm 25 and recently left my previous career as an accountant and have this fear that the class will be awkward and is likely going to be much younger people. Any advice on that? I also advised an AdScope 603 from Christmas from my wife. Would you say this is good enough to get me through my clinicals and coursework? Honestly, you can just get away. There's like a Littman, I think, for $75. That's a great one, and I'd highly recommend it. As far as going through your clinicals, though, I would recommend not bringing your stethoscope unless your instructor makes you, because it's a good tool that you can potentially lose. And even my stethoscope, like I don't bring it onto shift. We have stethoscopes in our box, and I wouldn't recommend anything fancy personally. As far as for your age, completely understand your concern. I was like 24, almost like 25 whenever I started my EMT basic. Then I just worked from there. I completely understand the concern, but trust me whenever I'm saying it really doesn't matter. Just focus on the class and have a lot of fun. There's going to be always, usually in like an EMT-B class, somebody who's around the age 30, 40, who's thinking the exact same thing you are. And trust me, once you start getting into class, you're going to be so focused on all the new information that you're going to get that you're not going to care about this age difference. But we love to have you. These accounting skills, by the way, are going to be very crucial later on in life. And your coworkers are definitely going to bother you a lot about it in the EMS field. So very cool that you got it. I actually would love to get a degree like this. This is something that I was kind of hesitant on putting in the PowerPoint, but I think it's very important to point out some mistakes that I make, right? So Axis IL6me said, why would you post this if they took 80, blah, 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 blah. I'm not reading the whole thing though. He's basically mad that I made a short video or I think they're called, YouTube shorts. And I talked about aspirin, what it's used for. And then I put the pills in my hand and I said 3 more pills adding up to 324 milligrams, but I didn't specify that it's 4 pills for 324 milligrams. And in all honesty, even though I'm not going to read all this, he's completely right. Okay. I made a mistake talking about a medication where I didn't properly discuss the dose, even though I visualized the dose and in my head I thought I said it. And I need to set myself at a higher standard and not mess up on medication dosaging. So I applaud this person for figuring out that I made a mistake and then commenting about it. I also messed up on my EKG, my third video. Even though I made it very clear that it was atrial flutter, I said atrial fibrillation at the end. And I'm just going to make some mistakes, unfortunately, sometimes. And I'm going to try my best to do the best that I can. I did take down this short because he's completely right. I messed up on the medication dosage, and I don't want to teach the public or the community anything incorrect. So thank you very much, Axis. I did reply to your comment. I left it out for a couple hours, and then afterwards I deleted the short because I was like, I don't want to have this misinformation out, but I want to see that I want him to see that I commented on his comment or I replied to it. So again, I apologize for the misinformation. It's my mistake. I will try to do better. Here's another question. I'm getting into EMT enrollment soon. Any tips before arrival? And really, there's not much I can tell you except maybe talk to an advisor, see what classes you may want to consider, especially like after you're done with your EMT, going to paramedic, and really just be open-minded and be teachable, right? Sometimes we have somebody who comes from a medical field, like I was a medical assistant, like an uncertified one, beforehand for X amount of years before I joined my EMS program. And I just made sure that even though I knew some things, that I didn't bolster around and say, oh, I know X amount of medicine, which really wasn't anything compared to my EMT skill. But don't be one of those individuals that think that they know too much to learn from the class, because those people are so difficult to teach. Just go in with an open mind and have a lot of fun. Be ready to make mistakes and don't be scared to make mistakes. Because whenever you answer a question and you say it wrong publicly, you learn from that. If you stay quiet in class, you're not going to learn. So I encourage you to be very engaging. Levy Kep says, no bothers at all. P.S. I'd love to see a video or short about status epilepticus or status seizures, as they are not as known. The recovery is going well other than tiredness. I don't remember exactly what we were talking about, but it's a great question asking about seizure videos or status epilepticus. I'll definitely go into that topic later, and I just think the more video questions or video information topics that I can gather, so I can know what to make for future content, it's just really helpful. So I really appreciate all the suggestions. Believe me, I have a section where I generally try to save questions like this on future video ideas, and I love them. So please keep it up. If you have a video suggestion that you want me to go over, please leave it in the comments. That's the end of our video. Special thanks to some of our channel members, such as Nathan Smith and Stephen Richards. We really appreciate your support. They help keep my educational videos as free videos. So I really love your support. If you did like this video, please consider liking, commenting, subscribing, even maybe consider being a channel member, huh? It's like the price of a coffee, and it keeps me going through the dopamine hit alone. But anyway, if you have any other suggestions or any comments that you want me to respond to, please just leave a comment in the video below, or maybe join the Discord and mention it there, and I'll try to pull it from there, have another frequently asked question video. But thank you guys for watching, and I'll see you on the next one. See ya.